This new program is an integrated program incorporating nutrition, acupuncture, hypnotherapy and counselling. And in this video, you're going to get the chance to hear from some leading experts in all 4 of those areas.
We have had very good success with people who are trying to have a baby. I've treated a lady who actually was on the waiting list for a hysterectomy. She had lots of complications and the gynecologist told her she'd never have another child, and she became pregnant. It's an intimate relationship really that we have with our patients. There's a lot of trust. It's very important, if anybody does want to have acupuncture in this country, that they go to somebody who is a member of the British Acupuncture Council. That will mean that they have studied for at least 3 years and that they have passed their exams and they know what they're doing. Some of the things I would say, if you were trying to have a baby, that would be helpful to you would be silly things. It might sound silly, but drink a lot of water. It really helps to keep hydrated. Take regular exercise. I don't mean necessarily going to the gym every day, but look after yourself. Take some fresh air. Be out in nature. Be present. Be in the now. Because often we put off happiness. We can't be happy until we have the baby. And we're missing so much now. Whereas the happier you are now, the better sex you have now, the more chance you have of having a baby.
Hypnotherapy is best described by imagining a deep relaxation, which is hypnosis. And when a client is taken into a deep relaxation, it's much more powerful to then use therapy to help that client to move on. For someone facing fertility issues, I would highly recommend addressing the stress levels, because the stress is going to have a huge impact, not the only impact, but will have an impact on fertility and successful conception. What is obviously important is to see someone who is qualified, who is insured, registered, and who knows what they're doing, and particularly when going for a speciality, for example, exploring hypnotherapy with fertility, to go to someone who has that experience and that knowledge.
I think one reason why nutritional therapy has such an amazing success rate is because we're working with the whole body. We work with every body system, getting the whole body well. So fertility is one of those things that then naturally seems to fall into place. One of the most important dietary strategies to take on board is to eat whole foods, not half foods. To eat the foods as our body is expecting them, with the nutrients our body needs. For instance, if you talk about carbohydrates, having the whole unrefined carbohydrates, the whole grain bread, rice, pasta, has up to 98% of 15 more nutrients than the white refined versions. When we're talking about fruits and vegetables, go for whole fruits and vegetables rather than juices. The whole fruits and vegetables have a whole array of different phytonutrients that we haven't even understood or recognised yet.
Two main focuses when I'm providing solutions for people facing fertility issues. Firstly, normalising their feelings, just letting them know that the feelings they're experiencing are totally normal. Anger, frustration, jealousy, bitterness, all of those kind of things, very normal. That's what most people will experience. So in terms of CBT for fertility, it's very easy to come up with a lot of negative thinking, understandably, about the situation. It's never going to happen, I feel trapped, I feel stuck, I feel scared, my body's not working properly. So with CBT, we can look at some of the thought processes and start to unravel them, look at how they're helpful and how they're unhelpful, and then come up with some tools and some stress management techniques so that you feel more equipped. With unexplained infertility, which is a big diagnosis for many people, it may well be worth exploring other avenues before signing up to IVF or fertility treatment. It may well be worth giving yourself a little bit of space and time to try acupuncture, to try nutrition, to try stress management programs, to try a wide variety of support things.
Okay, so I hope you've enjoyed listening to these experts. And again, if you've got any comments or questions, we'd love to hear them, and you can post them below this video. Stay tuned, because there'll be more like this to follow.